Today we're going to introduce Mike Cook, the president of Global Offsite Care. We're very fortunate at the Sonoma West Medical Center to have a leading provider of international medicine providing much needed medical services to underserved areas all over the world, emanating right here from Sonoma West Medical Center. So I'm very proud to introduce Mike.
Thanks, Ray. We're lucky to have Dr. Good here, who has started a center of telemedicine right here at Sonoma West Medical Center. And he's also a humanitarian, so he wanted to offer his services overseas. And since we started working with him, we now have developed 10 locations worldwide. And we mean by telemedicine the connecting doctor to doctor. So say a patient came into your emergency room and you didn't recognize the condition and you wanted some help. You can turn around and work through Dr. Good's organization and Global Offsite Care to get specialists, such as a neurologist, for example. Someone comes in, they say they've been hit in the head, you want to know whether you need to treat them for possible concussion. You need a neurological consult, and for that you can go through Dr. Good and have one within 15 or 20 minutes. And this would be someone from San Francisco who's worked worldwide. So that's one way that telemedicine can be a very effective extension of the capacity of any hospital, including this one. So we do telemedicine based on a platform of technology. We exercise internet connections that are available, and those capacities are expanding worldwide. And we connect up using systems like this one, which is a telemedicine robot. And the advantages there are that a doctor not on site can actually hear heart sounds through a stethoscope or see the images from an ultrasound probe that are connected to this robot. And the robot is helpful because it can move at the bidding of a remote doctor, so it can get a better view, it can zoom in on a patient, so you can see in detail what might be going on. And also gives the doctor a chance to interact with the patient, which is really special because they can then ask, how are you doing? Is the pain any better or worse? The leading questions, and they can get help from the staff that's local to the patient as well.
And isn't it true, Mike, that this particular model, the RP-VITA, is the latest model in a long line of in-touch video products and telemedicine robots?
That's my understanding. So now it has a lot of built-in capability, where before we had to have staff move the robot around to help speed things along. Now it can be pre-programmed. So a doctor who is remote can just tell the robot, go to this room, and it already knows how to get there. So it can not detract from staff time. You don't have to ask a nurse or an orderly to push it. You can get it there yourself.
Well, thank you, Mike. We really appreciate you being here today to talk about the RP-VITA and the Global Telemedicine Outreach Program coming out of Sonoma West Medical Center.
Great. Thank you, Ray.